Hello and welcome to C-Suite Middle East. I'm your host, Shane Phillips, and today we look at the story of Zahra Hospital, a brand which was phenomenally strong in Sharjah, but when they first entered the Dubai market, they struggled to find their stride. A new CEO was brought in, Dr. Mohaymen Abdelghany, and today he shares his insights on what he did to drive the organization to peak performance. Dr. Mohaymen, how did you use marketing and branding to help turn around the hospital?
Of course, you need always to present yourself to the community, to the market, and we used a mix of both above the line and below the line marketing tools and strategies. It's very important in these days to have good digital presence in the form of social media, internet presence, forums and blogs. All these are very important now because our patients are now, what we can say, more sophisticated. Their expectations are higher, especially the young population which is coming. They have very much higher expectations in terms of digital presence, in terms of digital response. You can have an unsatisfied patient posting on the social media and hurting your brand, really, if you don't know and you don't have the proper strategy to address this. This was part of what we looked at. I'm happy that currently we have more than 250K followers on our social media pages, which is something we're proud of. We started this perhaps 1.5 years ago. At the same time, we looked at how we can position our unique services. As I told you, the strategy was to move from the secondary to tertiary care hospital. So positioning our unique services through different exposures, exposing our doctors, exposing our services. And that happened actually on the level of the doctors, doctor-to-doctor communication, and also on the level of doctor-to-community and doctor-to-patient communication through different awareness, outreach campaigns, and community activities that helped us growing our presence.
Dr. Mohaymen, talk to us a little bit about medical tourism and how Dubai is taking advantage of that.
Actually, Dubai is doing a great role in this currently because His Highness Sheikh Mohammed bin Rashid had set a very ambitious target for Dubai to have 500,000 medical tourists by 2020. And Dubai Health Authority have established a medical tourism department which turned lately into a medical tourism council. We are sitting with the Dubai Health Authority on that Medical Tourism Council. The major private hospitals are part of this initiative. The initiative actually is trying to tap into the attractiveness of Dubai as a hub for tourism, for recreation, for amenities, for a huge infrastructure, for access through airlines. Emirates is accessing more than 150 cities globally. So putting this all together along with high-end healthcare services can really attract and can really tap into the global medical tourism movement. I think Dubai was successful in that till now. We have seen almost 200-something medical tourists last year. We're going to have this achieved, yet still need to have more coherent efforts. In the hospital, we see a lot of patients coming from Africa, patients coming from GCC, different countries of the GCC, Saudi, Kuwait, Qatar. We also see patients coming from East Europe for getting different treatments, especially that we are advancing on things like cancer, things like advanced plastic surgeries, things like advanced orthopedic surgeries. So I think the way the efforts are being now put together between Dubai Health Authority, the Medical Tourism Council, and the private hospitals, it's going to bring together some good results on the medical tourism front.
And you're seeing, Africans coming in. Which countries, or is that?
So we usually get patients from Nigeria, Ghana. This is the two main countries. Actually, we have presence. We do go and visit all these countries along with Dubai Health Authority. So we're going, for example, next week for the International Tourism Fair in Berlin, which is the largest. Dubai Health Authority with the major private hospitals are going there. We do go to Nigeria and Ghana, do exhibitions and roadshows. We do go to the IMTech, which is the International Medical Tourism Conference that's held. We regularly attend those to make sure that we are present there, we are offering our services, and we are also tapping into an entire experience of a patient from the time they arrive to the airport until the time they receive the treatment and they go back. So it's not just the medical treatment episode. We're talking about the entire treatment episode and journey to Dubai.
Great. Well, thank you so much, Dr. Mohaymen.
Thank you, Shane. Thank you.